Welcome, everyone. I hope everyone could get in here. I know I had one person having trouble, so hopefully everyone else can. Um, Good afternoon. My name is Renee Hawkins. I'm the Education Manager with the Michigan Center for Rural Health. The Michigan Center for Rural Health is a nonprofit state office of rural health. And a cornerstone of our office is to provide free education for rural healthcare providers. I'll be the facilitator of this program today, and I would like to welcome everyone to today's Special Populations Grand Round, our Veterans Series. This program is jointly provided by the Michigan Center for Rural Health, the Michigan State University College of Nursing, the Michigan Social Work CE Collaborative, Michigan Community Health Worker Alliance for Continuing Education. This session provides 1 hour for social work, community health workers, and nursing, and physicians can self-claim this hour. And I would like to introduce Adrienne Wilkerson from the Michigan State University College of Nursing to continue with the professional development information.
Thank you very much, Renee. So as Renee said, we do have continuing education credits available for various professions today. Nursing is included in that list, as she said. So this session will provide 1 contact hour of CNE. Our provider statement is listed on the screen for you to see so that you know that we are directly accredited through ANCC. And next. Thank you. So completion criteria for today is consistent with our other sessions, which is that you're participating as best you can by listening, being engaged as the speakers are presenting. And if you have questions along the way, you can put those questions into the chat or at the end of the session. So hopefully we should have time for Q&A, so you could bring those questions up at that point as well. And then at the end of the session today, we will have an evaluation that we will share the link with you. And we do ask that if you're able to, that you complete the evaluation as soon as possible. Today even would be great. That's just when the content is freshest in your mind and you're able to really respond regarding it. But we also know that that's not always possible as you're navigating a potential workday here. So the evaluation will stay open for a couple days still if needed for you to return to. And then financial disclosures are that there are no commercial interests associated with today's activity, and that nobody with the ability to control content of the activity has a relevant financial relationship with an ineligible company to disclose. And then just to bring you back to your goal as we head into the activity, that your goal for learning, your learning outcome goal is we hope that you'll walk away with increased knowledge of the Veterans Affairs billing and services. So I will hand it back to you, Renee. Thank you.
Thank you, Adrienne. And with that, I would like to introduce our presenters today. Emre, okay, I'm going to mess up your name, Umachu, I'm sorry. Umachu. Dr. Umachu's interdisciplinary research aims to improve health, rehabilitation, and community participation and well-being for individuals and veterans with chronic conditions, especially with those underserved and underrepresented, including veterans community. He collaborated with local, federal, and national and international agencies to create innovative solutions to complex health and community concerns. And his colleagues' research has been funded by federal agencies. His colleagues, excuse me. And Jason Maloney is the assistant professor at the Department of Social Work at the University of Texas in El Paso. Dr. Maloney is an experienced as a clinical social worker and program administrator, working with individuals with more serious mental conditions, survivors of sexual abuse and assault, children and adults in crisis, adolescents and adults with substance use disorders, LGBTQ individuals, veterans. He received his BA in visual arts from, sorry, I missed in visual art from Oberlin College in 2001, master's in education from Antioch University in 2007, and MSW from the University of Southern California in 2013. Additionally, a degree from the University of Pennsylvania in 2020. And with that, I would like to welcome both of you today to our grand rounds. Thank you for agreeing to be here, and we're excited to learn from you. And with that, I will go ahead and stop sharing my screen and have you guys have the floor. Thanks so much for being here.
Thank you, Rena. And I believe Jason is going to share the screen with us, and we can go ahead and then start for our presentation today. All right. So again, welcome everyone. Again, thank you so much, Rena, for introducing us and having us today for talking about this very important but also complicated topic for healthcare providers, including nurses, social workers, and physicians. Our topic today is request for services and VA billing, which is a quite complicated topic and process for community care workers and healthcare providers. We wanted to discuss this topic because if you look at Michigan demographics, about 30% of Michigan veterans are living in rural communities, and they may really struggle to access healthcare, particularly specialty care services. So these veterans are also really struggling, with finding internet access, transportation issues, and they may also feel that their healthcare providers do not really understand their military experiences, which is about military culture. So that's why we wanted to cover this topic and to help you guys, to really understand what to do when it comes to, requesting some important services for veterans and veteran communities. Again, my name is Dr. Emre Umucu, and I am an associate professor in public health sciences and associate dean for research at UT El Paso. I am also a program analyst at South Texas VA Medical Center here in San Antonio. And my research is basically examining, how to make veterans healthier, happier, and wealthier. So this is my three philosophy to make veterans healthier, happier, and wealthier. I am also principal investigator for iReach Rural Veterans Program that is housed under Michigan Center for Rural Health. Next slide, please. So before we start our presentation, I just want to take a moment and acknowledge the support for this project. The iReach Rural Veterans Initiative, identified by grant number here in this slide, is supported by the Health Resources and Services Administration, or called HRSA, of the United States Department of Health and Human Services. It is important to note that the contents of this presentation reflects the view of the authors and do not necessarily represent the official views of or nor endorsement by HRSA, Health and Human Services, or the U.S. government. Again, I thank you for understanding, and now let's go and then get started for the presentation. Next slide, please. Okay, so for today's presentation, after our acknowledgement is done, we will have 4 important learning objectives. And I'm really hoping at the end of this presentation, you will learn about receiving care at both VA and non-VA facilities for veterans and exploring the differences and similarities in accessing those services. And for example, nurses will understand how to assist veterans in transitioning from inpatient care at a VA facility to outpatient services in the community. And social workers can also, understand some of those resources available at veteran centers that provide counseling, psychotherapy and support for veterans, reintegrating them into civilian life. You will also learn about and understand the request for services procedures as we guide you through the steps involved in requesting care. However, again, please keep in mind that the VA system can be really complicated sometimes, right? So this training alone is not gonna fix everything or answer all of your questions, but our goal is to have this presentation a as a 101 lecture. And then we are really hoping you will respond to our survey at the end of the presentation and tell us what else, other topics you are really requesting from us, and then we can definitely provide those trainings to you as well. Third, we will also discuss prescription procedures and payment processes, including how prescriptions are managed and available payment options, such as co-payments and for medications. And finally, you will be also familiarize yourself with VA billing procedures, including Medicare, Medicaid, and Medicare supplement services. And we will also have understanding of these billing procedures and how to navigate these, procedures in healthcare, services. Like I said, I'm very excited, and my colleague Jason is also very excited to cover this topic with you guys today. But we will also really appreciate, again, you guys provide us some feedback at the end, and then we can develop new trainings for you guys for really deep diving into this topic. Next slide, please. Okay, so the first topic is gonna be, accessing care at the VA and requesting community care services. You can go back to, previous slide, Jason, for a second, please. I will just, okay. Accessing care at the VA is a really critical responsibility for healthcare providers, as it is essential to guide veterans through the VA healthcare system. Eligible veterans can access a comprehensive range of services, including primary care, specialty services, and mental health support. To facilitate this, providers like you should encourage enrollment in the VA system by assisting veterans with the application process and also gathering the necessary documentation for eligibility. Once veterans are enrolled, it is important to establish care coordination. Veterans should have a designated primary care provider who can manage their healthcare needs and also make referrals to specialists as required. In some cases, actually, veterans may need services that are not available within the VA, or may prefer to seek care in their community, or there is no even service because they may be living in rural locations. So that's why it is very important for you guys to understand where is the services available and how to help veterans to get those services and access those services. I think understanding this process for requesting community care is really important, and providers should assess the need for community care during evaluations. For example, if a veteran expresses a need for services outside of the VA, I think we should take some time to discuss their preferences that will really help them to engage with healthcare services, because if we understand their needs and their preferences and then provide them autonomy for accessing to healthcare services, I think they will be having better relationship with you as a nurse and social workers or physicians. Next slide, please. Okay, so accessing care at the VA involves understanding both VA-related facilities and options outside of the VA. I believe, from my experiences in the past at Michigan, many colleagues, who are nurses or social workers or physicians, were really struggling where to seek services when it comes to veterans, because VA provides services. Outside of VA, you can find services, but sometimes it makes veterans really nervous, or their caregivers really nervous about whether that will be billed, or there are some issues with benefits. So that's why it's really important to understand whether veterans can take services from VA or outside of the VA. So if you look at the VA-related facilities, the VA offers a variety of healthcare facilities designed to meet the unique needs of veterans. VA medical centers provide comprehensive services, including inpatient and outpatient care, specialized services, and emergency care. We also have community-based outpatient clinics that serve veterans in rural and underserved areas. We also have veteran centers that focuses on readjustment counseling and supports for veterans and their families, and also addressing mental health needs and social reintegration. VA also provides some community link centers, services, which is more like long-term care in residential settings for veterans with chronic illnesses or disabilities. VA may also provide some home-based services for home health services, hospice care, allowing veterans to maintain their independence while receiving necessary support. And VA also has like some expanded telehealth services, especially for those who cannot access to VA services because of transportation problem or geographical, like isolations. That's why I think like understanding these services provided by VA is really important. And luckily, veterans are also eligible to receive services outside of the VA. So they can have community care program, which allows them to receive services from local in-network providers. And not all veterans, and this is important, not all veterans qualify for community care, as eligibility often requires that VA facilities are unavailable or that the veteran prefers community services. As healthcare providers, it is essential to assist veterans in understanding the process for requesting community care, including initiating a request with their VA provider and ensuring they have the necessary documentation. Emphasizing continuity of the care is also very important for veterans, and we need to follow up with them whether they are receiving services or not, and that will really help them again like to be part of the healthcare services and not really drop out the treatment. That will really help them to be again like being healthier. Next slide, please. Okay, so this slide is like really cool, and this website is also like really interesting, and you provide a lot of great information. Okay, to find a VA healthcare facility or in-network providers, you can basically visit this website we put there and in this slide. And this resource provides an easy way to search for various VA locations, including medical centers, community-based outpatient clinics, and other services. For example, and as a nurse, you might use this tool to locate the nearest VA medical center for a veteran requiring specialized cardiac care, or to find community pharmacy for managing prescriptions. Similarly, social workers or other healthcare providers can use this website to identify local vet centers where they can connect veterans with mental health support and readjustment counseling. All you need to do is basically you just put zip code or city name or the state, and then it is going to provide you all the information, what type of services are available. And you need to also pick a facility type, and those facility types include VA health facilities, urgent care centers, emergency services, community providers, community pharmacies, VA benefit offices, VA cemeteries, and also veteran centers. Again, this slide, this website is so cool. I just tried today again, I just put 79912, and then it lists all of those, important VA healthcare services and facilities, when you need help from VA officials. Next slide, please. So, as I said, veterans can receive a lot of services from VA and outside of VA, right? But like anything else, they need to be eligible for, some of those services. For example, to be eligible for the community care program, veterans must meet several important criteria. And for you guys as a healthcare professionals, it is very important you guys understand these eligibility criteria, because you don't want to misguide veterans for certain services they are not even eligible, right? So first, they must receive prior approval from the VA before they obtain care from a community provider, unless it is an emergency situation such as sudden heart attack or severe injury. Okay, like I said, first eligibility is they need to get an approval from VA to be eligible for community care services, except emergency situation. Additionally, veterans must be enrolled in a VA healthcare center or be eligible for VA care without needing to enroll, which can be the case for certain service-connected disabilities. And continued eligibility also depends on the individual veteran's healthcare needs and circumstances, with a VA staff typically responsible for making these determinations, so you don't need to worry about that. For example, if a veteran has a chronic pain and requires specialized physical therapy not available at the VA, the staff will evaluate the request based on their specific situation. And it's also important to note that even if a veteran qualifies for a community care, they still have the option to receive the care at a VA facility for their treatment. The beauty of community care program is in case veterans are not preferring receiving services from VA, or they are living in an extreme frontier or rural locations, there is no available specialty care, so then they can go to community care program. And lastly, the veteran must meet at least one of the 6 specific eligibility criteria outlined by the VA, and such as living far from VA facility or needing care for a condition that the VA cannot provide. And also understanding these requirements really help nurses and other healthcare providers effectively guide veterans in accessing the appropriate care and ensuring they receive services they need. Next slide, please. Again, to continue, qualifying for community care program, veterans also must meet at least one of the following criteria. First, if the service they need is not available at the VA medical facility, they may seek community care. For example, a veteran requiring a specific surgical procedure that the VA does not offer would be eligible. Okay. Second, veterans who live in the United States, US state or territory without a full service VA medical facility can also qualify for community care program. This may also apply to veterans residing in rural locations or frontier locations. Additionally, veterans may be grandfathered into a previous 40-mile criterion if they lived more than 40 miles from the closest VA facility since at least June 6, 2018, continue to live in that location and reside in states like Alaska, Montana, North Dakota, South Dakota, and Wyoming. And this means that even if circumstances change, these veterans maintain eligibility for community care based on their established distance from the VA services. I think understanding these criteria and I will talk about some other criteria as well, will really help you guys to provide accurate information and support to veterans seeking community care options. Next slide, please. And the fourth eligibility criteria for community care program is that it must be determined that seeking community care is in the veteran's best medical interest. For instance, if a nearby VA facility lacks the necessary specialization, so then that makes sense. Veteran is receiving care from community care program. The fifth criteria is if a VA service line does not meet established quality standards, such as a facility that fails to provide care aligned with the VA's quality-based care standards, then veterans can seek care in the community as well. And final criteria is that the VA must be unable to provide care within designated access standards, which includes an average drive time of 30 minutes for primary mental health or non-institutional care, or 60 minutes for specialty care. Additionally, if wait times exceeds 20 days for primary mental health or non-institutional care, or 28 days for specialty care, veterans are eligible for community care as well. As you see, I think VA has the best interest for veterans, and they want them to receive services from community care program. I think these criteria are really making sense for veterans and healthcare providers to really understand, to make sure they are receiving appropriate and effective healthcare services from their region, their location. This is all I have for so far. I think next my colleague is going to talk about the other important topics as well. Jason.
Thank you, Dr. Amushu. Hey everyone, my name is Jason Maloney, and I'm a clinical assistant professor at UTEP. I work alongside Dr. Amushu, and I've had the pleasure of working with him on this iReach program, where we're disseminating information to hopefully increase access to services and knowledge for rural veterans, and really for providers as well. Dr. Amushu talked about the different types of services available through the VA and the eligibility criteria for veterans to receive services. outside the VA system through the community care program. I'm going to shift a little bit more in terms of the policies and kind of procedures for what that looks like. I do want to emphasize that one of the goals of our training is really to help providers empower veterans to be advocates for their own care, to really be the ones driving their care. And so in order to do that, providers need to understand what can be complicated processes at times. So I want to just give a little bit of background. Receiving care outside of the VA used to be seen as a last resort, but with the VA Mission Act in 2018, Congress set out to increase choice for veterans and to increase options for veterans. And in 2014, the Veterans Health Administration spending on care outside of the VA was $7.9 billion. And in 2021, it was $17.6 billion, which I think really shows, a commitment to providing choice to veterans. And that accounted for about 20% of the Veterans Health Administration budget. But as with any changes and expansions to delivery services, there are challenges in understanding how to navigate those systems. So there are multiple pathways through which a request for community care can be initiated. The veteran can request these appointments through scheduling a new appointment with their primary VA medical provider. As Dr. Amushu mentioned, if the primary provider or if the social worker or nurse working on the treatment team identifies a service that the veteran may need that may better be filled through an outside community provider, they can work with the veteran to initiate that process. So ensuring the veteran is receiving authorized by the VA through the community care program requires that we take an integrated and collaborative approach. Once a referral is made or requested by the community provider, the process is streamlined through the HealthShare Referral Manager system. It can be linked to on the website at the bottom of the slide, and these slides, I believe, will be shared. That centralized medical record system supports access information across the veterans treatment team and facilitation of community-based service provision. The VA can make community care referrals directly in the system, and community providers can submit requests for services, track authorization statuses, and submit claims to receive timely payments. I'll get into how community providers qualify to provide services to veterans, but for those who are credentialed through TriWest or Optum, often these processes go directly through their systems. But coordinating requests for services and referrals through this system ensures that the VA's integrated care team can coordinate and monitor services provided and follow up with the veteran after the episode of care. Providers who are within the VA Community Care Network, or as I mentioned, are credentialed with TriWest or Optum, can visit the website again on this slide and learn how to enroll in HealthShare Referral Management System. One of the goals of this program is really to increase the exchange of information so that everyone who is providing care to the veteran has access to that information and can provide the best comprehensive care possible. So if you're a community provider, you're a social worker, or you're working in a clinic and you are not necessarily in network, you can reach out to the VA to develop a veterans care agreement. You just go to the closest VA medical facility, and once you've established that agreement, you can then access the HealthShare Referral Management System. For clinics and care teams credentialed with the VA or that have an established veterans care agreement, all staff can access the referral management system after registering and completing training. So for example, if a social worker in the office is part of a community-based clinic, that clinic could seek the VA affiliation through these pathways and allow for the clinicians, other providers, nurses, administrative support to utilize HealthShare Referral Manager to navigate the veterans care. All of these pathways for community providers to serve veterans are designed to promote veteran-centered, timely, seamless, and collaborative care. Again, you can go to the website at the bottom of this slide to learn more about that. I know there's a lot of information in this presentation, but there's a lot to cover. And as Dr. Amuju mentioned, this is the 101, and we encourage you to continue seeking out information after this. So a veteran may initiate the process for receiving services from a community provider through their VA medical facility. They can ask that their VA doctor initiate a community care department consult. This can be for a range of services from medical to behavioral health care, also to specialty care. And the community care department will review and the consult request and contact the veteran if they need more information or if the consult is approved. The community care department contacts the veteran's preferred provider to confirm that they're in network and schedules the appointment. The veteran may schedule their own appointment, but they should contact the local community care department first to ensure that the VA authorization is in place. The veteran and or the community provider can reach out to the community care coordination team at the Veterans VA Medical Center or healthcare system where their primary doctor is located. The contact information for each facility's care coordination team is listed on the website provided on the slide. As you can see from the screenshot, there are also centralized resources on the navigation column related to the community care program, intended for veterans, their families, caregivers, and a range of providers. Additional information about the policies and procedures I've described can be found there. It's also important to note that the veteran can communicate directly with their care team online by establishing an account at www.myhealth.va.gov. I'm going to repeat that since it's not on the slide, www.myhealth.va.gov. Now, we recognize that veterans have a range of technological preferences, and so while these online interactive systems are available, the veteran can also contact the VA directly to facilitate these processes. But if the veteran is set up in this system, they can use it. It's a secure platform that they can use to request referrals, monitor their service requests, access health records, schedule appointments, and send messages to members of their VA healthcare team. So some additional information on community care. Once the requested community care is authorized, the veteran will receive an authorization letter that includes the authorization number and the approved in-network provider that the veteran can receive services from. The authorization letter also details the duration of services authorized, and the veteran could schedule future appointments directly with that community provider. So if you are, if you're a licensed clinical social worker and you're seeing a veteran in the community for outpatient mental health services, the number of sessions and the length of time will be detailed in this authorization. The veteran and the community provider should be aware that the VA will not pay for services beyond what is described in the authorization, but an additional request for services can be initiated to continue care beyond the time specified in the initial authorization. I used to be the clinical director for Western Montana Mental Health Center in rural Northwest Montana, and we served a lot of veterans in various programming that was short-term, long-term. It really varied, some crisis stabilization, and it's important to get these authorizations in place. And we found that seeking continuation of services to be a pretty seamless process with our local VA medical facility. So I'm going to talk a little bit about prescription coverage, because often community providers may need to provide or may need to prescribe medications for the veteran that they're seeing. If the medication is deemed urgent or emergent, basically meaning that it's included on the VA urgent or emergent formulary list, up to a 14-day supply can be obtained at an in-network or out-of-network pharmacy. This prescriber can verify the medication on the urgent or emergent formulary list by clicking the VA formulary advisory link at the top of the first website listed at the bottom of this page. The direct link to the page is www.va.gov/formulary-advisor/. I'm going to repeat that again, www.va.gov/formulary-advisor/. Again, the veteran may fill the prescription at an in or out-of-network pharmacy, but if the veteran fills the prescription in an out-of-network pharmacy, the veteran has to pay for the prescription up front and submits a claim for reimbursement through their VA medical center or healthcare facility. Additional information on filing a claim can be found on the second website at the bottom of the slide. For urgent or emergent prescriptions, supplies greater than 14 days, the veteran must fill the prescription at the VA Medical Center pharmacy, again, unless the community provider deems that there's an urgent need for the medication. The community provider can also prescribe routine or maintenance medications included on the general VA formulary, which is also on the site that I mentioned before, for up to 90 days with refills not to exceed 12 months in total. These prescriptions must be filled at the VA Medical Center pharmacy, though. When submitting a prescription, the provider must include the patient's full name, their address, date of birth, gender, phone number, and drug allergies. Provider may also provide the veteran's social security number, but this is optional. Provider information must include the provider's full name, address, phone and fax number, personal drug enforcement agency number, and national provider identifier number. If the veteran or provider has any questions, they can contact the Veterans Community Care Department directly. So there may be times when it's necessary for the veteran to seek and receive emergency care, either at a VA facility or at a non-VA facility. Emergency care that's not pre-authorized may only qualify for VA payment if obtained at an emergency room department. So what this means is that if the veteran seeks the care at an urgent care clinic, it may not qualify. So if you're in contact with a veteran who is experiencing an emergency, you'll want to direct them to either the VA emergency department or a local emergency room. The provider delivering emergency services must notify the VA within 72 hours of when the veteran arrived at the facility through the VA Emergency Care Reporting Portal detailed on this slide, or by calling 844-724-7842. The veteran or someone acting on the behalf of the veteran may also notify the VA. I have found in practice, the more people who notify the VA of changes in care or care needs, the more collaborative and informed the VA can be in responding to them. So there are specific eligibility requirements related to receiving emergency medical care or non-mental health care, and then receiving mental health care, which I'll detail on the next slides. To be eligible for non-mental health related emergency care, such as medical care at a non-VA facility, the veteran must meet multiple eligibility requirements. First, the veteran must be enrolled in VA healthcare or have a qualifying exemption from enrollment. This can be certain disability status, or qualifying exemptions include having a service-connected disability or falling under certain income thresholds. For the most part, enrollment in VA healthcare is required to receive emergency care at a non-VA facility. Receiving care at a VA emergency facility must also be unfeasible. So what that means really is that the time it would take to get the veteran to the VA emergency facility would hamper their care. They wouldn't be able to receive the care fast enough. The way that additional criteria is that a person with average knowledge of health and medicine would reasonably believe that a delay in seeking care could put the veteran's life in danger. When seeking emergency care at a non-VA facility, provider and veteran must ensure the care is reported again within 72 hours of when it began. It's important to note that non-VA emergency care is only covered until the VA can safely transport the veteran to a VA facility, and the facility is able to accept the transfer of care. Eligibility for care at non-VA emergency room departments for emergency mental health needs differ from non-mental health needs. So to receive this care, the veteran must meet at least one of three requirements. The veteran experienced military sexual trauma, battering, or harassment while serving, or served on active duty for more than 24 months and did not receive a dishonorable discharge, or served more than 100 days under a combat exclusion or in support of a contingency operation and did not receive a dishonorable discharge. Now, if you're working with a veteran that has received a dishonorable discharge, there is a process in place to request a review of that discharge status or a character evaluation to change that status. That's just an aside. However, for veterans who are in acute suicidal crisis, that veteran may go to any VA or non-VA facility to receive care at no cost, including inpatient and crisis residential care for up to 30 days and outpatient care for 90 days. Veterans don't need to be enrolled in the VA system to use this benefit. Any veteran can also access the Veterans Crisis Line 24 hours a day, 7 days a week by dialing the national line 988 and pressing 1, texting to 838-255, or initiating an online chat at veteranscrisisline.net. So veterans and their caregivers are encouraged to dial 911 or go to the nearest emergency department if they feel their life is in danger. Emergency care is generally viewed as authorized or unauthorized. Even if it's unauthorized, the veteran's care may be covered in certain situations. Emergency care is considered authorized if the community-based emergency facility is in the community care network and the VA is notified within 72 hours of the veteran's arrival. Emergency care that doesn't meet these general eligibility requirements but is considered service-connected is viewed as unauthorized but may be covered. That basically means it may be covered under these special circumstances. So if the care received was for the service-connected condition or a condition that was worsened by the service-connected condition, the veteran is rated as permanently or totally disabled, or the care was needed to help the veteran return to the VA Veteran Readiness and Employment Program. Again, a service-connected condition is defined as a condition that the veteran has received any VA disability rating for. One of the reasons we're sharing this information with you is that a lot of times nurses, social workers, doctors, they're the ones who are helping the veteran navigate these systems and empower the veteran to advocate for themselves. And so it's important for providers to have an understanding of what these rules and requirements consist of. For unauthorized emergency care not considered service-connected, the veteran still may be covered if the care was received at a hospital emergency department or facility providing emergency care to the public, and the veteran received care at the VA or an in-network facility within 24 months prior to that date of service, and the emergency care was needed because of an accident or injury. If the veteran receives a bill and believes they should be covered, they should contact the VA at 877-881-7618. There are a couple additional areas we want to touch upon in this presentation. First, we want to discuss situations where veterans may have multiple insurance sources. This commonly occurs when a veteran turns 65 and is eligible for Medicare. The VA strongly encourages veterans to sign up for Medicare, as it may cover services that the VA doesn't cover, and it additionally opens up the veteran to receive services at non-VA hospitals or by non-VA doctors. Their prescription coverage may also be expanded if they sign up for Part D. Also, if the veteran delays signing up for Part B, they may incur a penalty if they want to sign up later. Lastly, the VA healthcare is dependent upon congressional approval. So the budgeting for this may change with any congressional administration. As well, the VA can better coordinate services that comprehensively cover the veteran's healthcare needs if they are aware of all insurance sources the veteran possesses or is eligible for. The VA will bill the private party insurance or third party insurance on behalf of the veteran, and those funds go back into the VA healthcare system. There may be situations where the veteran receives a bill for copayments depending on their disability rating and whether they have private insurance, Medicare, and or Medicaid when they're receiving community-based care. As a provider, you can encourage the veteran to contact their local community care department to find out more information about the bill they've received and if the claim was processed accordingly given the care circumstances. Now, just some information for providers on filing community care claims. If your provider of services to veterans and plan to bill the VA for those services, there are a few things you need to keep in mind. For all non-urgent and non-emergent care, this requires advanced authorization, as we detailed earlier in the presentation. If you're credentialed again with TriWest or Optum, you must file the claim directly with that third-party administrator. If you have a Veterans Care Agreement or a contract with the local VA facility, you'll file that claim directly with the VA. You can learn more about submission requirements by visiting and downloading the PDF fact sheet linked on the website. We encourage you to familiarize yourself with the documentation that's required for claim submission. And this form also details, it's also detailed in the authorization for community care document received prior to pre-authorized services. You can also find out more about how to file claims by visiting the website at the bottom of the slide. On this slide, you'll find resources for filing unauthorized emergency care and authorized medical, dental, mental health, and emergency care. While claims can be filed electronically or by paper, it's highly recommended to file electronically, as this reduces the risk of error and keeps documentation in one repository. So this last slide just shows you some of the partners who are involved in this program and preparing content like this for your learning. We hope that you've had a good learning experience and that this has served as a 101. And I think that Dr. Amuju and I can take questions if there are any. So I'm going to go ahead and stop sharing this slide.
Thank you, Dr. Malone. I think this was great. Again, if you guys have any questions, please just write your questions or send us email. I'm going to put my email here as well in case you want to ask later. We may not respond all the questions because we are not like specifically working under VA benefits office, but we will do our best to recommend some websites or help you guys to go through specific individuals who may really know these answers for you guys. So
it looks like we did have a couple of questions in the chat.
Yeah, I'm seeing one of the question. I think, are all veterans screened when going through ER? I believe they do, but what happens, I think this comes from Victoria, when they go through ER, sometimes hospitals or ER clinics may not ask whether the person is veteran or not. But that is what we are actually trying to do with iReach program. And I see Jim Yates is here, our program coordinator and program manager as well. So we are really not pushing, but advocating for clinics and in Michigan to ask their patients a question which is are they veteran or not? So then it will really help us to actually navigate those services better. Because if your clinic is not able to help in ER, then we can provide or refer these veterans to, like some VA clinics or like some other services. So that is what we are doing right now. The
Yeah,
other
I'll
Oh,
just
go
add
ahead.
on the service provider side, we encourage really screening for veteran status at any time someone initiates services at your facility or is attempting to receiving care at a emergency room. In most places, that's standard practice. It's a question on the intake form.
Mhm. And the next question I'm seeing here is how long does the referral process take? Each episode of care would need a new referral. Jason, do you have any response for this one?
Yeah, I don't know exactly the length time. I know the VA is really striving, and if it's really the veteran and the provider can advocate with the veteran's primary VA medical provider to expedite those services. And you can reach the community care department coordination department at the VA medical facility to follow up with that.
And I just want to add that, I just put a link here for all of you. You can actually see, like the average wait times at, like individual facilities. And you can literally search, like by putting zip code and what type of services you need. And it's going to tell you what is the wait line for referral or, like receiving services for veteran population. I think that is an excellent tool for all of you in community when you are working with veteran, like population.
Mhm.
So the
And
next, go ahead.
quickly, each episode of care typically does require a new authorization, but the duration of the authorization is determined through collaboration with the community provider and the VA to determine the length of an initial authorization. So it's not necessarily that every single visit has to be pre-authorized, but the episode of care will be kind of determined through the authorization process, and then it can be reviewed and reauthorized.
Thank you, Jason. One of the question I'm seeing, if the veteran doesn't get I don't know what's AU authorization, I believe, for an emergency visit and has other insurance, can we bill his other insurance?
So the veteran, if the veteran has any other insurances, the veteran can choose whichever insurance they wish to utilize in any given circumstance. So if the veteran has private insurance that they could utilize in an emergency department, the emergency department can bill that insurance source.
Thank you, Jason. And one of the questions is in our ED, I don't know what that means, but do the ones medically stable for mental health, I think it's a more comment. We coordinate with the VA if patient needing inpatient psych placement. Mhm. One question is, go
I
ahead.
think I think that makes sense. Really, the VA is looking for stabilization and ability to transition to a VA care facility. However, if you work in rural areas, you'll sometimes find that there aren't beds available in those facilities, in which case the veteran would be eligible to continue receiving those services until they're able to be transferred to a VA facility and the facility has the capacity to accept the patient.
Mhm. I see one comment from Victoria. I have seen where some veterans don't get the same level of care due to what their status is, like 8%. And I believe that is like service connected disability percentage, percent to 100%, and getting placed in agency to get the help they are in need of. Yeah. Sandra says, can you add the link to the survey to the chat? I believe Rina, can you help us with that? I don't have the link.
Yep, I have it right here.
Okay, thank you. And Marcy is asking, can the vets choose his private insurance, Medicare, over his VA for SNF also? Jason, I believe they do, right?
Yeah,
So they can
yeah.
pick any insurance.
So they have that choice. If you're making the referral to a skilled nursing facility, it may be, in everyone's best interest to have a conversation with the VA, the veteran's VA doctor, to determine which would be, most feasible and have most of the services covered. There's also a question up above, going back to Veterans Care Agreement. Is a community connector for a healthcare agency who assists patients daily. Will the agreement allow access to submit direct referral for our clients for veteran resources or assistance? So if you have an established community care agreement with the VA outside of, let's say, the TRICARE or Optum authorization, you can request referrals directly in that health share electronic record system. You could, as far as submitting direct referrals for other services involved at the VA, I would probably recommend that the VA doctor assigned to the veteran initiate those referrals if the service is requiring a referral. So for example, if you're wanting to send someone to the vet center for some mental health care, those don't involve or require a referral. The vet can initiate those services on their own.
Mhm. Jason? I think one last question is for prescriptions using community care for the 14-day supply, what is the needed to get this approved and covered?
Yeah, so really for that, if they're using a community care for the 14-day supply, you just need to be sure to submit all that information with the prescription and look on the VA formulary list to make sure that that medication is covered for urgent, emergent needs for veterans. And if you check on that website and find that it is, you can submit the prescription. It's easiest if you submit it to a VA pharmacy because the veteran then doesn't have to pay up front. But if you submit it to a local pharmacy, your local Walgreens, and they're not in network with the VA, then the veteran would have to pay for that up front and then submit a reimbursement claim.
Okay.
Someone just asked if they'll have a copy of this program. I am recording it, so we will send out the recording as well as the slides for this presentation.
Great. I think it is almost 11. Well, 11 in Mountain Time, so 1 p.m. I believe there, right? Look, thank you so much, everyone, for having us. I'm so thankful for Jason being with me today and you're like helping us responding those questions. And now he's the expert here. You're like for all of these benefits related questions because I have been asking him a lot of these questions as well. Look, please respond to the survey and help us to understand what you need for these type of trainings, and then we will definitely provide you these type of trainings more to help our heroes living in Michigan, especially in those rural areas. Again, we are so thankful you have been here with us and then listening our presentation.
I just want to add, in terms of benefits related questions, I would really encourage you to seek out a VA benefits advisor.
Yes.
And just to make sure that whatever services or processes that you're using are going to result in the veteran receiving the care that they need.
Yes, and thank you to the both of you for being here today. We truly appreciate your time and look forward to the continued relationship with you guys with the series. So thank you.
Thank you all.
Yeah, thanks for having us and thanks for joining, everyone.